Hey everyone, welcome to Wealth Redefined. I'm your host, Michael Reynolds, certified financial planner and owner of Elevation Financial on the web at elevationfinancial.com. So today's topic is Medicare, original Medicare versus Medicare Advantage plans. What's the difference? We're going to explain the difference and talk through it. So, as you approach age 65, maybe you're not close to age 65, maybe you are. But as you approach age 65, one of the most important and sometimes confusing financial decisions that you're going to face is how to structure your Medicare coverage. So, understanding the differences between original Medicare and Medicare Advantage plans is pretty important to help you make an informed decision that fits your healthcare needs, your financial situations, and your life in general. So, we're going to break that down a little more clearly so you can avoid some common issues and make sure you're confident as you plan for this. So, first, what is Medicare? Just a quick recap. Medicare is the national health insurance program for people age 65 and older. It includes a few components. One component is Part A, which is your hospital insurance. Part B is your just general medical insurance. And Part D is your prescription drug coverage. Those are kind of the essential core parts of Medicare. Part A and Part B are really the core. And then Part D is sort of an add on. And there's Medigap, which we'll talk about in a minute, but that's kind of the core of what it is. So, original Medicare is managed by the federal government. It works with any doctor or hospital that accepts Medicare and was designed as a payment system, not necessarily a care delivery system, but a payment system. So, in contrast, Medicare Advantage, which is also known as Part C, is offered by private insurance companies approved by Medicare to provide Part A and Part B coverage, and often bundles in Part D and other benefits with it. So, when you are deciding on Medicare, there's an initial fork in the road, so to speak. And you kind of face a decision. Do you enroll in original Medicare with supplemental coverage or a Medicare Advantage plan? That's kind of the fork in the road to decide on. So, the original Medicare path, what is that? That enrolls you in Part A and Part B. Typically, you want to add a Medigap policy, also called a supplemental policy, and that covers costs that Medicare doesn't pay. It sort of takes care of the rest of the stuff that Medicare doesn't pay. Most people also add a standalone Part D drug plan. These are for prescription drugs. So Medicare, the original Medicare service gives you greater flexibility with providers, and there's no network restrictions. So again, it allows you to go to any doctor or hospital or facility that accepts Medicare, which is the vast majority, quite honestly. So Medicare Advantage, let's look at that path. Medicare Advantage is one plan, and it usually bundles parts A, B, and D. And it often also includes extras like vision, dental, maybe even gym memberships or wellness things. Typically lower premiums, sometimes even no premiums. It is a managed care network like an HMO or a PPO. And there's potential for limited access to specialists and care outside of local areas. So it does have this whole in-network component to it. So what are some common misconceptions? So many people mistakenly believe that Medicare Advantage is the only way to get Medicare because there's lots of aggressive advertising, especially during open enrollment. The ads often downplay limitations like network restrictions or prior authorizations. So it's important to note that original Medicare is available and often better suited for those who travel or need specialized care, which we'll talk about in a minute as well. So let's talk about the pros and cons. So original Medicare, what are some of the pros of original Medicare? One is freedom of choice. You can see any provider nationwide who accepts Medicare. And again, the vast majority of providers do accept Medicare. There's pretty stable benefits. Medigap policies, which is the add-on supplemental policies, don't really change. So that's going to be pretty stable. There's also predictable costs. With a comprehensive Medigap plan, for example, like Plan G, out-of-pocket expenses are pretty minimal. Also, you don't need prior authorizations. There's less red tape when looking for healthcare. Okay, so why choose Medicare Advantage? What are some pros of Medicare Advantage? Lower or even zero premium sometimes. The benefits are bundled together. So dental, vision, hearing, sometimes Part B premium, rebates, all can be bundled together. So that's convenient. The convenience is attractive to some. So one plan handles everything. And it can be attractive to healthy individuals. So it's especially appealing if care usage is pretty minimal. If you don't use healthcare that often, it can be attractive. There's a caveat, though, we'll talk about in a minute, but that's assuming that you stay healthy your entire life and the entire time you're using Medicare Advantage. So here's something to think about. For individuals who travel frequently within the United States, there are important differences between original Medicare and Medicare Advantage plans. So original Medicare offers nationwide access to care, which allows you to see any doctor or any specialist in the US who accepts Medicare. And that makes it really well suited for those who have multiple residences or maybe you travel a lot. There's no network restrictions, so you're not limited by geographic location. And most services don't require prior authorization, which makes it easier to get care while you're on the road. In contrast, Medicare Advantage plans often have regional provider networks. And if you're outside your plan service area, you might not be covered for non emergency care, which can be a big drawback if you travel frequently. So, some Medicare Advantage PPO plans do allow out of network care. It might come with higher out of pocket costs. So, regular travel outside your home area can complicate care access and potentially result in some unexpected expenses. So, for those reasons, original Medicare combined with a Medigap policy is generally a better fit for those who need flexibility to get health care across the country. There's also a risk of starting with Medicare Advantage. So here's the catch you want to think about. Switching from Medicare Advantage to original Medicare later can be tricky because you might not qualify for a Medigap policy if your health has declined because insurers can deny coverage based on medical underwriting unless you're in that 6-month Medigap enrollment period. So once you pass that enrollment period, you have to go through underwriting if you want to get Medigap, and you might not pass underwriting at that point. So that means that Medicare Advantage can be cheaper up front. It can lead to higher long-term costs long-term if serious healthcare issues arise. Also, that limited network access can be an issue. It's a gamble, and many people end up regretting it. So remember that it can be tempting to choose a plan based on the fact that you're healthy now and don't utilize a lot of healthcare services. That can change at any time. It's difficult to predict how your health may change in the future. So I'm trying to kind of lay this out in a balanced, objective way, but there's a very real risk that I do want to highlight. So it is important to understand that. So we've talked about Medigap a little bit. What is Medigap? Medigap policies help cover costs not paid by original Medicare. These are things like coinsurance and deductibles. And the most comprehensive currently available plan is Plan G. That's the one that most people opt for. It's generally the one that makes the most sense for most people. So some key points of Medigap to help understand that is the premiums can vary widely based on location and insurer. And once you buy Medigap, benefits remain the same as long as the premiums are paid. The policies don't cover vision, dental, or hearing aids or care outside the U.S. Also, Medigap policies are standardized, which makes the price comparison pretty straightforward. So you just kind of look at the price, and that's how you compare. So Medicare Advantage, there's some trade-offs. Again, going back to Medicare Advantage to kind of compare these, Medicare Advantage plans operate on 1-year contracts. Benefits and provider networks can change yearly. If Medicare cuts payments to those private plans, then insurers may react by narrowing their networks, reducing benefits, or even increasing out-of-pocket costs. So these plans are profitable for insurers, which incentivizes heavy promotion, heavy advertising. Brokers often receive higher commissions for Medicare Advantage sales, and that can influence their recommendations as well. So be careful about the recommendations you get and the biases behind those recommendations. What about a cost comparison? So original Medicare, these costs, by the way, are current as of 2025. Original Medicare Part B premiums are around 175. Medigap premiums are 160 to 230 typically in that range. Part D premiums can be as low as 50 cents a month. And they're generally predictable. Costs are capped if Plan G is selected. So those are kind of the general ballpark of plans for original Medicare. Medicare Advantage, Part B premium does still apply, but many plans have no additional premiums. but there's a cost sharing at the point of care. So there's co-insurance, and out-of-pocket annual max can be anywhere from $4,000 to $9,000. There are some key enrollment timelines to consider. So the initial enrollment period for Medicare starts 3 months before turning 65 and ends 3 months after turning 65. So that's your 7-month window to enroll in Medicare. The Medigap enrollment period is 6 months after enrolling in Part B. And the annual enrollment period where you can make changes is October 15th through December 7th. And that's when you can review or change plans. The Medicare Advantage open enrollment is January 1 to March 31. And that's the time where you can switch or return to original Medicare, again, with some caveats and restrictions if you want to. So when it comes to choosing the right Medicare plan, you want to keep these things in mind. 1, research your options early. Make sure you get a good handle on what your options are before it's time to enroll, so you've got time. Make sure you understand the irreversible nature of some decisions. So keep in mind, if you go for Medicare Advantage and later change your mind, you may not be eligible for Medigap at that point, which can increase your cost overall, and that's an irreversible decision. Look for unbiased resources like Medicare.gov to get your information, and understand the long-term benefits of flexibility and the comprehensive coverage that original Medicare can give you. So keep those things in mind. Medicare is one of the best health insurance programs available, and it's a fantastic benefit when you turn 65. So be sure you research your options really carefully so you can choose the right plan based on your healthcare needs. So, all right, with that in mind, as always, you can reach out if you have questions. You can book a free consultation on my website, elevationfinancial.com, or if you want, you can send me a note there or through social media, pretty much everywhere. Easy to find. All right, with that, thanks for joining me today. Have a great day. We'll see you next time.